Hello, everyone. Greetings for the day. I'm Sayukta Banerjee from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. We all know taking good care of our skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. If you take care of it, it can help take care of you. This is why it is so important to have a well thought out skincare healthy routine. It is pretty well known that how important skincare regime is. You will feel better when you look better. Having a daily skincare routine helps you to look your best and put your best foot forward when you go out into the world. In today's busy world, cosmetic products are an integral part of daily lifestyle. But are they healthy for your skin? So let's connect today with our skin expert, Dr. Vrinda Thorat, live from Pune to enlighten us on the topic of skin health beyond cosmetics. Dr. Vrinda Thorat is a consultant dermatologist and cosmetologist at Skin Era Clinic, Baner, Pune, consultant at KEM Hospital and Jupiter Hospital, Pune. Dr. Vrinda has done DNB from MGM Medical College, Mumbai. She has huge experience in dermatologist surgery, dermatosurgeries, lasers, and cosmetology. Also, she is a speaker at national conferences and at various social platforms. Today, the market is rife with an array of skincare products as consumers. It's quite confusing for us. Patients visiting Dr. Vrinda Thorat comes with positivity and are very confident after receiving treatment. Dr. Vrinda Thorat treatment have benefited many patients. Welcome, Dr. Vrinda Thorat, on this very platform.
And thanks for that wonderful introduction.
Dr. Vrinda, first of all, I'd like to ask you a very general question. We all are very confused about the use of sunscreen. Why do we need sunscreen? Why to use sunscreen?
Okay, so before starting talking about sunscreen, I need to tell you all something that there are certain products which everyone should use regularly. Like you have to choose certain products very cautiously, like the face wash which you use, the moisturizer which you use, the sunscreen, and the night creams. So yeah, so we can talk about sunscreen.
Yes.
So since we all know the ozone layer has depleted, so a lot of UV light which comes and falls on our skin. So it has its own effects and side effects on our skin. So UV light can cause pigmentation on our skin, then photo aging, like fine lines and wrinkles on our skin. So we have to use sunscreen very regularly to avoid these pigmentation problems and the aging of our skin.
Okay, so that's why sunscreen is very important. But the one more question is that how to choose right kind of sunscreen, because there are so many sunscreen when we go out to get one.
Right. So there are types of sunscreen. There are certain over-the-counter sunscreen and there are certain sunscreen which your dermatologist can prescribe to you. Okay. So generally before prescribing any product, one should be aware, or we can make you aware about your skin type. So the one can have dry type of skin or oily type of a skin or mixed type of a skin, or there can be a sensitive type of a skin, or there is a combination type of a skin. So for choosing the right sunscreen, you should be aware of your skin type. The generally gel forms of sunscreen goes well with acne prone skin and oily skin. The lotion forms, they are more for your body. The cream based sunscreens are required for dry skin. And while choosing the right sunscreen, we always think about the SPF factor of the sunscreen. So there are various types of SPF which are available, the sunscreen which are available in various SPF forms. So for Indian type of skin, any type around the 30 SPF is good enough. Basically what this SPF indicates, it indicates how much UVB light that sunscreen absorbs. So more the SPF, more of a UVB light get absorbed by the sunscreen. Then another thing is where really do you want to use your sunscreen, whether you want to use it indoor outdoor, or in a very harsh environments. So there are types of sunscreen. There are certain physical sunscreen and there are certain chemical sunscreen. So physical sunscreen, they kind of form barrier on your skin and they just reflect the sunlight. So whenever you're going in a very harsh sunlight or outdoors, you can use good physical sunscreen. Like what you see the cricketers or the players, they use very thick type of a sunscreen, but you don't have to use that thick layer of a sunscreen, because certain physical sunscreen, they come in a micronized form, so they don't show on your skin. When we are going to talk about the chemical sunscreen, a good combination of physical and chemical sunscreen is cosmetically better accepted. So for the regular use, you can use the combination. And nowadays, everybody's like, we hear from a lot of people, like though I'm inside the house, like the whole of 2 years I've spent in front of my laptop or computer, still I'm getting tanned, still my skin is looking dull. So there is something called blue light, which gets emitted from your screens. So iron oxide containing sunscreen, they can protect your skin from this blue light also. So you have to use sunscreen sometimes indoor also whenever you are getting the pigmentation problem.
Yes, so you need to know about your skin type plus the environment you are in to choose the right kind of sunscreen. Dr. Vrinda, I would also like to know about moisturizer. We all know and we have often heard that we should use proper moisturizer. So is there a need of using regular moisturizer, and how to choose the right one?
Yes, definitely. You have to use your moisturizer very regularly. So moisturizer, these are the agents which basically maintains the water content of your skin whenever you apply them. So your skin is constantly under environmental, whatever the environmental changes happens, your skin is under stress of those environmental changes. So you have to protect your skin from those changes. So again, the moisturizer also, they come in various forms, like lotion forms, gel forms, or cream-based forms, or there are certain very thick moisturizer like petroleum jelly and all. So who can use which moisturizer? So these petroleum jelly base or very thick moisturizers are generally prescribed for particular kind of a skin problem. Like if you have an eczema problem or psoriasis kind of a problem, you need to use those thick moisturizers. Gel based moisturizers are good again for oily skin and acne prone skin. Generally, people ask, I have an oily skin and the acne prone skin patient, they ask, like we don't like using moisturizers. It makes our skin more oily. So it has to be in a different way. You have to choose the sunscreen which is thin, gel based, which will not give that more oily look to your skin. And you need moisturizers because acne prone and oily skin is more prone to damage. So they have to use gel based moisturizers. Then cream based are more cosmetically accepted moisturizer. So if you have a normal skin, you can use cream based moisturizers. And lotion based again you can use for the body.
Yes, so again you need to first find out
so Yogita, I want to add one more thing. You should know the right way to apply the moisturizer also. Whenever you wash your skin or face, immediately within 30 seconds, you have to put the moisturizer so that it gets absorbed completely. And you have to apply moisturizer whenever you are applying on your hands or body. You have to apply along the direction of your hair follicle. If you apply in the reverse direction, it can cause problem. So immediate application after dabbing your skin and application of a moisturizer in the direction of the hair follicle is very important. For face, you can use moisturizer 2 to 3 times in a day. For body, 2 times in a day is good enough.
Yes, so it's just not the right kind of moisturizer, but also how to use it. The application should be proper as well. Dr. Vrinda, I would also like to talk about face wash. Again, we know it's important, but there are so many. So which one to use?
My answer will go in similar fashion. You should know your skin type. If you have an oily skin, there are certain face washes which can control oil from your face, like salicylic acid containing face washes or glycolic acid containing face washes. They generally controls the oil from your face. If you have a dry skin, you use mild face washes. And if you have a combination type of skin, you can use little exfoliative face washes also, like lactic acid containing face washes, or again the mild concentration of glycolic acid using face washes are good enough.
Yes. Now it was all about face wash, moisturizer, sunscreen. One more product that we have started hearing about is night creams. So from what age should we start using them, and how to choose again the right night cream?
You can start using night cream from very early young age also. Like if your skin is showing any problems, the night creams, they come in a different forms. Night cream is not a particular night cream or particular content which you can say it's a night cream. So there are various type of night creams. Some night creams, they contain vitamin C. If you have a pigmentation problem, you can use vitamin C based night creams. But vitamin C can dry your skin sometimes. So if you have a dry skin, avoid using a vitamin C based night creams. There are certain night creams which are moisturizing, like hyaluronic acid based moisturizers, night creams, or zinc oxide containing night creams. They're healing also, they give good moisturizer to your skin also. So if you are facing the dry, night cream is basically the cream which stays on your face for a longer time. So it can correct whatever the damage has happened, or whatever your requirement, it can fulfill your requirement. So for your pigmentation, you can use vitamin C based night creams. For your hydration or repair of your skin, you can use hyaluronic acid based night cream or zinc oxide based night creams. If there are fine lines or wrinkles, there is something called retinol or vitamin A derivative based night creams, which you can use for a little longer time.
Yes, so depending on the need of our skin,
Yes.
we can use night cream.
And there's no right age. You can start at earlier age also.
Okay, so don't wait, just go for it if you want to. Dr. Vrinda, will you please talk about fairness creams?
Okay. This is my favorite topic actually, to talk about fairness, because I always think fairness creams comes in two forms: over the counter fairness creams and the fairness cream which are medicated fairness cream or advised by dermatologist. So over the counter, let me talk first about what are the content of these fairness creams. So there is first and foremost very important product is called hydroquinone. So it reduces the melanocytes, it reduces the pigmentation of your skin, but it has to use for a specific period. Otherwise, the hydroquinone it itself settles down on your skin and shows the side effect. So it has to be medically advised. The hydroquinone based fairness cream has to be advised by your dermatologist. Then there's another depigmenting agent like kojic acid based depigmenting cream. Then glycolic lactic acid based depigmenting cream, niacinamide. We keep hearing about niacinamide a lot these days. These all other products like kojic acid or lactic, glycolic acid, all these are very safe safe products to use in your depigmenting or fairness cream. But there are certain fairness cream which had steroids into it. So don't use without your doctor's prescription, or don't use it for a very long time. It is not going to help you. It is going to cause more of a side effect. So fairness creams has to be always used with a caution.
Very important to be noted, just don't go by the flow. Ask your dermatologist, then only buy the right fairness cream.
Yeah, and one more thing, Yogita, I want to add. It's not that for certain type of fairness cream suits to your friend, the same night cream or same fairness cream will suit to you. So it has to be as per your skin type and as per your requirement also.
Exactly. So your skin type, the environment you are into, the requirement of your skin, it all adds on to tell you what kind of fairness cream or night cream or face wash or moisturizer or sunscreen, as a matter of fact, you need. Dr. Vrinda, I don't know how common it was earlier, but nowadays we see a lot of people complaining about pigmentation. So why pigmentation problem has become so common these days?
There are various causes of pigmentation, it could be familial, like if your mother or if your sister, if it is there in your family, you can get that pigmentation as your genetics or as your hereditary problem. A second thing is hormonal imbalance, like thyroid problem or any other hormonal issues like PCOD, any issues with your periods. They can also cause pigmentation on your face. Another thing, there are certain drugs like OCPs. They also stimulate your melanocyte, your pigment producing cells. And these drugs also can cause more of a pigmentation on your skin. Sun exposure. The, the UV light has changed completely. So excess of sun exposure, and if you're not using sunscreen, it causes more of a pigmentation. So that's how nowadays more of a pigmentation problems are there.
So better to avoid start using sunscreen. Is that what you're saying?
Yes, you have to use your sunscreen very regularly.
Okay. And what treatments do you recommend for pigmentation or skin glow?
Yeah. Prevention is always better than cure. So as we discussed, sunscreen is the first and foremost important thing in your fairness regime, has to be in your fairness regime or your glow regime. Another thing, protecting your skin from harsh UV rays. You can always cover your face with the scarf or use caps or hats. Physical protection is also better. Avoid going out in the harsh sun, like between 11 to 3 as far as possible. Don't go out in that harsh sun. Then your diet also plays important role in your glow, like for even reducing pigmentation from your skin. Vitamin C rich food like lemon, amla, or orange, mosambi, all these things, they can give you a good vitamin C, and vitamin C has a good antioxidant properties as well as it can reduce the pigmentation from your skin. So these are the general measures. There are certain, as we have already spoken about, fairness creams. As per your doctor's advice, there are certain face washes which can also reduce pigmentation from your face. And if it's very resistant pigment, then as a dermatologist, we advise certain treatments. Like there's something called peeling treatment, which we do in our clinic. Or there are certain laser treatment which break the resistant pigmentation and it gets absorbed in your skin. So it's called Q switch laser. So all these options are available for very resistant pigmentation.
Yes, a lot many options are there for the treatment of pigmentation, but it's always better to, just don't let it even occur. And for that, you need to use the right kind of sunscreen. Dr. Vrinda, moving forward, will you please elaborate more on skin peeling treatment? You just mentioned a little bit about it.
Okay. So I would like to talk about this treatment because lot of people, they hear either right, wrong, or mixed reviews, or it's lot of talk about these treatments, but people are not aware what these treatments are really meant for or what is it really. So these are the basically creams or serums, or it has certain agents which are called alpha hydroxy or beta hydroxy agent. They have their own properties. Like there are certain peels which are salicylic base peels. There are certain glycolic, lactic acid based peels. So, and there are certain vitamin A derived cream base or retinol base peeling treatments are available. So these are, so when we are talking about salicylic acid peeling treatment, so these are mainly advised for oily skin or acne prone skin. So what are these agents really do? So they are anti-inflammatory agents. They kind of shrink your sebaceous gland. Your oiliness of your skin reduces, and the frequency of pimple is also reduces with these salicylic acid peeling treatments. And you need sitting like 2 to 3 weeks apart. You have to do sittings for the sessions for the same peeling agent. So salicylic basically helps for pimples. Then there are lactic acid based peeling treatment, which hydrates and which removes the dull layer of your skin. It gives glow also. Glycolic is again glycolic or acylic. They are again glow giving treatment piece, or they remove the dead layer and pigmentation from your skin. There are certain advanced peel like vitamin A derivative or retinol based peeling treatments. So they are mostly used for aging processes or fine lines. So they remove the dead layer and the new soft, supple skins regenerate faster and it gives glow to your skin.
Right. So these are the various skin peeling treatments available. Dr. Vrinda, I would also like to know about your take on Parlor Facials, because right now you explained about the skin peeling treatments, which are very scientific, I can say. So your take on Parlor Facials?
Parlor facials are they have to be done as per your skin type. Like there are certain fruit facials or some other facials are also available. So you cannot take the facials if you have a oily skin and very thick cream based facials, or if you have a dry skin or sensitive skin. There are certain regions which really irritates your skin. So you have to be aware. You have to be aware the products which are used for your skin, or you should be aware whether it suits to your skin or not. So just make sure that right products are used, then you can undergo the facials also. There are certain facials called Medi facials, which dermatologists advise. We have certain machines or instruments, and we also do certain Medi facials in our clinics also.
Yes, so the thumb rule stays that know your skin first. Again, know your requirement first, and also know about the products the parlor is using as
Yes,
parlor
it's your
facial.
right. Actually, it's your right to know what products has been used.
Exactly, exactly. Dr. Vrinda, we have heard a lot about vitamin C tablets, vitamin C serums. So, what is the role of these vitamin C tablets and vitamin C serum? We, of course, know that vitamin C is very vital as far as skin is concerned, but how about the tablets and serum?
Yeah, even during COVID, we all have taken vitamin C. So vitamin C is again antioxidant rich molecule. So your aging, your pigmentation is reduced with oral vitamin C. So anything around 500 milligram to 1000 milligram of vitamin C is good for your skin. And I have already spoken about vitamin C serum. It can be used as a night cream, or it can be used as a base cream for your skin. So you can apply vitamin C serum first, and then on top of that moisturizer. The last layer has to be always sunscreen. That's the way you should apply your creams, or your regime has to go. So vitamin C is good. It gives soft and suppleness to your skin. It gives glow. But in certain type of a skin, you cannot, like some people, they cannot tolerate vitamin C. So go slow with vitamin C. Start using only on the weekends or alternate days, or you choose the right type of a vitamin C, because vitamin C molecule is a very unstable molecule. So you have to choose the right type of vitamin C cream also.
So right type of vitamin C is important to choose, and again, take care of your skin by applying the vitamin C serum, then moisturizer, then sunscreen, but go little slow with vitamin C serum.
Right.
And Dr. Vrinda, we have seen that many a times, even if we don't have any problems with our skin, we start using some of the home remedies or the other, and supposedly if there is any, acne or any other kind of problem, then definitely we'll go for the home remedies first.
Right.
What do you advise on home remedies?
Okay. So home remedy, don't keep on changing your home remedies. Like if you're using the milk cream, your skin has to be dry. Don't use milk cream on oily skin. If you're using multani mitti or chandan or haldi, your skin has to be normal type of a skin. Don't use all these products on very sensitive type of skin. And whenever you're using it, you have to wash it very carefully. Otherwise, if you go out in the sun with those natural products, lot of photosensitivity happens. And be gentle, like don't rub those products on your skin. Like apply it gently, then wash it gently. See the frequency, what frequency is going good with your skin. Don't keep applying every now and then. So they're good to use, but you have to choose the right thing for your skin.
Yes, so you can go for home remedies, of course, they are good, but then use them wisely and don't overdo any of it. Right. Can we use over-the-counter plant-based products or organic products, Dr. Vrinda? Because nowadays we are hearing about a lot of plant-based products or organic products in the market.
Yeah, the same thing like home remedies. You have to choose them wisely. It has to suit your skin. It's not that if it suits to one person, it will suit to you also. And see, all these plant products, they also need some base or some preservatives. So unless and until it's mentioned what preservative it's been, like don't buy something which has not written the products inside it or what are the ingredients of those creams. So you can use them, but go through the ingredients. Just see if it suits to you, suits to your skin. Then you can go for those products.
We can also do a patch test before
Yeah,
going for
you can
it.
do the patch test also. Like the patch test, like in front of your ear, 1 or 2 centimeter, you can keep applying those creams for 2-3 days. See how it reacts, how it suits to your skin, and then you can apply it like all over your face. Just don't apply anything new all over your face.
Fair enough. Dr. Vrinda, we have heard a lot about skin rejuvenation treatments. Can you throw some light over it? Skin rejuvenation treatments.
Right. So as we have already spoken about peeling treatment, it's again a type of skin rejuvenation treatment. The vitamin A derived products or retinol based peels, they rejuvenate your skin. Another thing, there are certain lasers like fractional CO2 or micro needling. All these things or microdermabrasion. Microdermabrasion is very mild abrasion of your skin and which stimulates the new type of a skin. It rejuvenate your skin. Then there is something called micro needling. So in which we stimulate your skin with very fine needles and we apply some serums to rejuvenate your skin. So there are micro needling treatment. There are mesotherapy treatment where we inject some growth factors or some skin rejuvenating products on your skin. Then there are certain lasers which stimulate your collagen or your skin. So you can go for those lasers also. And there are Botox and filler treatments also, which are a little advanced treatments.
Okay, so good to know that there are so many skin rejuvenation treatments available. Dr. Brenda, we were talking about pigmentation. There's also eye pigmentation, which is becoming a huge problem with people. What is the treatment for under eye pigmentation and under eye creams?
See, first of all, we need to know about the causes of under eye pigmentation. So a lot of strain on your eyes, if you're in front of a screen for a very long time, it causes a lot of strain on your eyes. Even the blue light which is emitted from your screens can cause pigmentation. Anemia, less of iron in your body, then thyroid problems. Then are certain things called acanthosis, the thickening of your skin at certain body parts around your neck. The same acanthosis because of some hormonal issues or because of improper diet can cause pigmentation around your eyes also. So you have to treat the cause first, and there are certain under eye creams which can rejuvenate your under eye pigment or under eye skin.
Okay. So first of all, try to find out the reason behind under eye pigmentation and then move on treating it. Dr. Vrinda, I'm sure many of our viewers would also like to join with me in asking about what should be our daily skin routine. So what do you suggest should be our daily routine for our skin? Perhaps starting from sunscreen, moisturizer to night creams.
So Yukita, pardon, will you please repeat the question?
Sure, sure. I was asking about the daily skin routine. What are your suggestions regarding how should be our daily skin routine? And perhaps we can start from moisturizers to sunscreen to night creams.
Yes. So as I already mentioned, the right face wash, right sunscreen, right moisturizer, and right cream. These are the basic products which everyone should use. And how to apply it, I'll repeat it again. Like first has to be vitamin C serum if it suits to your skin. Then on top of that, you can use moisturizer, and on top of moisturizer, you can use sunscreen. But there are certain sunscreen which has moisturizer in itself. So then you can skip moisturizer, you can directly apply your sunscreen on top of vitamin C serum.
Yes, so this is how the chronology should be. Dr. Vrinda, yes. Dr. Vrinda, I would also like to know that people often complain about pigmentation. We have spoken about pigmentation, but then there are other things as well, like dealing with our teens, adolescents, pimples, acne for us too. Dr. Vrinda, would you please elaborate on this, its causes and treatments?
See, our 60 to 70% OPD is filled with acne patient or hair fall patient. So it's like really a big problem these days. So yeah, of course, I would like to talk more about on acne. So one should know the main causes of acne so that we can treat accordingly. So during your teenage, a little hormonal fluctuation can cause acne. Another thing, hormonal imbalance like PCOD or any other hormonal issues also induce more of a pimples on your skin. Then improper skin regime or improper choosing of your skin products can cause more, like if you have a acne prone skin and if you use oil base or more of a thick creams on your face, it leads to more of a pimples on your face. Then lifestyle is very important. There are certain food items like sweets, whether it's Indian sweets or chocolates. These are called high glycemic index food, which stimulates pimple glands on your skin. In food, you can say the sugar products, then oily products, refined flour things, bread and biscuit. Like anything in too much is not good for your skin. Even milk products. Anything like 250 ml of milk product is allowed. 1 glass of milk or 1 glass of buttermilk is good, but don't have too much of a curd, cheese or paneer. All these food items, they stimulate your pimple glands. Then proper nighttime sleep. Normal body hormone, they generally get secreted in the evening time. If you don't sleep properly, that hormonal fluctuation is going to happen and it again stimulate pimples. Lack of exercise, sedentary lifestyle again induces pimples. So we have to work as per the cause of the pimples. Then we can treat. I always say treating pimples is very easy than treating marks and scars. So always take treatment for pimples. Never hesitate. Never say that it's just a teenage or it's a problem for some days and then I'll skip the treatment. Never do that. It's very easy to treat pimples. Little lifestyle modification is going to help you. Then never pick up your acne. As I said, treating pimples is easy, but after picking, whatever scar and mark it leaves, it takes a lot of time to go off. So never pick up your acne. Acne prone skin becomes very sensitive. So don't keep on fluctuating between products. Like don't use too many of products at the same time. Use the right face wash, right moisturizer, and whatever pimple anti-acne treatment your doctor suggests. So use that those products. And another thing, few of my patients, they continue using that for a very long time. So clear gel or clindamycin gel. So if you keep using those antibiotic creams for a very long time, resistance happens. So they stop working on your pimples. So take your doctor's advice and then only treat your pimples.
Yes, so treating acne is easier than treating scars and marks. So it's better to treat your acne first and eat well, eat balanced as well. Dr. Vrinda, we are going through weather change, and with changing weather comes dryness of hands, allergies, eczema. Dr. Vrinda, your suggestions, please, on the preventive measures and how can we shield ourselves better?
Okay, so do you want me to talk about hand eczema and hand allergies?
Yes, please.
Okay, so why these hand eczemas or hand allergies happens? We have a protective layer of on our skin, which kind of protects our skin from environment or whatever is coming in contact with our skin. Yeah. Yes. So you have to use right type of a moisturizer and use the moisturizer very frequently. If your skin becomes sensitive, don't come in contact with your detergent very frequently. You can use the hand brushes to clean your utensil. Then don't use rubber gloves directly. They rub on your skin and they causes more of a damage. So use cotton, get cotton gloves stitched of your size, and on top of that,
Yes, so I think first of all, we need to wear cotton gloves, and over that, we can use rubber gloves. That's what you were saying, Dr.
yes.
Vrinda?
Yes, and one of my patients, she has suggested you can distribute the work among your family members also. That is also one of the tips I really want to add. Yeah.
Yes, yes. Dr. Vrinda, we have started washing our hands quite often after COVID. You must
Right.
have also observed it. Any tips on this new habit of ours? Because it's
Yeah.
making our skin more dry.
Right. You can use moisturizer very frequently and apply moisturizer immediately washing your hands. So in a daytime, like 10 to 15 times, you can use the moisturizer, no problem. And as far as possible, use mild hand washes. Like you can use, you don't have to go for a Dettol hand wash or very harsh hand washes. You can use the mild hand wash for your skin, for your hands.
Okay. Dr. Vrinda, we have some queries from our audience, and I'm taking them one by one. So Anjay Mishra is asking, since I lead a busy life, I need to keep my routine simple. What can be done?
Yes, yeah, this is the question asked by many working women.
Yeah.
So, yeah. So, the right type of a face wash, right moisturizer, and night sunscreen. These three products has to be there with you. And if you start getting any of like problems on your skin, if you see any like you're facing any problems with your skin, you can start using night creams as per your requirement, as I mentioned, like vitamin C based night creams or hyaluronic acid, like moisturizing night creams, or retinol based night creams, you can start using. So that's
Yes,
an optional thing, but sometimes the night creams are also required.
exactly. One of our audience, Atul Sharma, is asking, what is the gold standard therapy in melasma?
Melasma is a very resistant pigmentation. It takes a lot of time to go off. It has its own fluctuating pores. It keeps coming and going back. So as I mentioned, prevention is better than cure. So always use the right type of a sunscreen. If you're going outdoors, and even for melasma patient, they have to use the sunscreen indoor also. And depigmenting cream. All these and protecting your skin from harsh sunlight is has to be there for melasma patients.
Exactly. So protecting your skin from harsh sun is very important. Sanjana Pandey is asking Dr. Vrinda, is it possible to get a sunburn if it's cloudy?
It's a very good question. It just slipped from my mind. So yeah, even though it's a cloudy season, like if you see the clouds, but the UV rays they pass through the clouds, and whatever side effects they want to cause, it can still happen during cloudy days also. So if even though it's a cloudy season, you will have to use sunscreen very regularly. And as you mentioned, during cloudy days, we don't use sunscreen, so our skin becomes more prone to sunburns. And like we don't feel sun that harshly, so we tend to go out more. But UV rays are there, so that's how during cloudy season, like many people, they get sunburn.
One more of our viewer, Parul Shinde, she is asking how wrinkling of skin happened in human aging. What are latest advancements in managing these? Very interesting question.
Yes. So as we grow, our skin keep on changing. So the water content of our skin goes down. Then we have certain layer, epidermis, dermis. So that dermis has a collagen. So that collagen content also goes down. Even the fat content, we have some fat compartments of our face. So that also goes down as we grow. So we have to work on each and every layer to manage wrinkling of our skin. So the upper layer, as I mentioned, your dried skin or your wrinkled skin can be managed, like the fine lines can be managed with superficial treatment like microdermabrasion or mesotherapy or peeling treatments or the superficial lasers we can use. But once the deeper damage happens, we have to use certain advanced treatments. Like there are deeper lasers also, or Botox, or fillers, or there are certain ultrasound therapies which stimulate your collagen. So one has to go for the right type of a treatment. And again, first and foremost important thing is right diet, and choosing right skin regime is very important. You can actually delay your skin aging by 10 years by choosing right products and right food, good exercise and sleep.
As you mentioned exercise, our next viewer is Nisha Sharma, who's asking, should I wash my skin after working out?
Yes, you have to, because a lot of see, your sweat contains lot of salts, so we don't want those salts to get deposited on your skin. So every time you work out, and even it attracts lot of dust also on your skin, which can block your pores. So every time you do the workout, please wash your face.
Okay, and Shiva Shukla is asking, does stress contribute to skin aging?
Yes. It's a well, uh, we have a certain like with the stress, the oxidation of our skin happens very faster. So the antioxidants which reduces in our skin. So stress definitely contribute to skin aging.
Okay.
It's kind of related to oxidative damage to your skin. So you have to take a lot of antioxidants also whenever you feel your stress or your skin is aging faster. And it's available in your diet also, or you can take the external supplement also. Like antioxidant rich foods are your berries or your dry fruits. They are rich in antioxidants.
Okay, so take care of your diet, take care of your stress, don't stress much. Soumya Shukla is asking, which vitamins are important for the skin?
Okay, it's a good question. So vitamin C for your glow, and it's a good antioxidant. Vitamin A, rich food like papaya, carrot, orange, and yellow fruits and vegetables are rich in vitamin A. So vitamin A is important. You can take it through diet or through external supplement. It protects your skin from sun damage, as well as it gives good antioxidant to your skin. So vitamin A, vitamin C, and vitamin E is very important for your skin. And another thing, vitamin D. We never had to do conscious efforts for vitamin D, but since last 2 years, we were completely inside the house. There is like lot many people, they have faced vitamin D deficiency, which again causes lot of skin and hair problems also. Vitamin D has good anti-inflammatory properties. So in lot of skin conditions, vitamin D3 level has to be at good amount. So all these are important vitamins. It's a good question.
Yes, yes. Shilpi Yadav was asking, though you have answered it, but still her question is, can diet really affect acne?
Yeah, I can elaborate on it, because every now and then, even teenagers, they keep arguing. It's just that you say these kind of foods, they causes more of acne. It's not like that. Like milk product, like cheese, paneer, curd, all these products, they have insulin-like factors, but they stimulate your sebaceous gland. Even your sweets, Indian sweets or chocolates, they also stimulate sebaceous gland. Oily stuff or the refined flour things, these are like one can experience. If you can avoid those food, your acne goes down. And even your stomach issues, it's not that it's written somewhere or it's a misconception. You have normal gut bacteria. If you have stomach issues, those gut bacteria get disturbed, and then lot of other bacteria, they go and sit on your skin. So you have to take care of your gut bacteria through right diet and the right routine.
Exactly. Sonia Shinde is asking, does sunscreen expire? Interesting one.
Yes, it has its own expiry dates also, and once you open the product, you cannot use for a very long time, because with opening, its ingredients also get disintegrated. So there are certain sunscreen which you can use within 1 or 2 months. There are certain sunscreen which you can use for 6 months also. So don't use it for a very long time once you open it, and always look for the expiry date, which is already written on the creams or on the packet itself.
Fair enough. Ishita Jha, she is asking, what products should everyone have in their skincare routine?
Okay, it has to be as per age, your skin type. Same, I'll repeat my answer. The right face wash, right moisturizer, right sunscreen, and right night cream.
Okay. Now, Soumya Shukla is asking, what does PA+++ mean? Please, doctor, let me know.
Yeah. So how the SPF factor is mentioned on your sunscreen. So SPF factor is the amount of UVB light get absorbed once you apply the sunscreen. PA factor is how much UVA light is getting absorbed. So PA++ is good. PA 3 times plus is again good. This basically indicates how much UVA light is getting absorbed absorbed or reflected through your sunscreen. So you should know. And it's not that it's written like a lot of over-the-counter products, they write this PA factor or SPF factor written, but it's not medically proven or it's not well tested. So it's always better to use medically tested products with these labels like SPF or PA factors.
Okay, and Dr. Tripti Pandesh is asking, which sunscreen ingredients carry health risk?
Yeah. So, the physical sunscreen, zinc oxide, iron oxide, titanium dioxide, these are very safe products to use. Even anyone who is above 6 months can use it, and even during pregnancy, you can use the physical sunscreen. There are certain chemical sunscreens. So they have their risk factors, but it's not that it's very risky or carcinogenic or something. It's not like that, but generally physical sunscreen are good for very young patients or during pregnancy, and chemical sunscreens which are advised by doctors, you can use good combination of physical and chemical sunscreens.
Okay, quickly we'll take the last question from our viewer, Reena Sharma. Is it crazy to think about drinks with anti-aging properties? That's her question.
Yeah.
I think she's mentioning alcohol.
Alcohol, yeah.
Yeah. So
Okay.
what's your take, doctor?
With anti-aging it's crazy to think about alcohol with anti-aging properties. Okay. So with the alcohol, there are certain food products or there are certain food vitamins. It doesn't get absorbed properly. So with anything in moderation is good. Like wine, the moderate amount of wine is always said good for your skin. It has antioxidant. So it's not that we have to go completely against drinks and your skin. So there are anything in moderation is good. Like red wine in moderation is good. But anything in excess which is going to harm your skin or which is going to interfere in absorption of certain vitamins is definitely going to push yourself more for a aging process.
Thank you very much, Dr. Vrinda Thorat, for your valuable time. And it has been quite an informative session for our viewers.
So.
We really look forward for many more such sessions in coming times. Thank you, viewers, for an excellent participation as well.
Thank you, Sanyogita. Thank you, Katim, and thank you, viewers, for asking so many questions. And I really had a good discussion with you all.
Likewise, Dr. Vrinda. For more information and updates on skin health and care, stay connected on our FB page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to all of you. And we would also like to tell you that if you want to contact Dr. Vrinda Thorat, you can at the number 750771006. And her clinic is at Baner, Pune, Skin Era Clinic. So you can contact Dr. Vrinda Thorat at 750771006. 750771006 is a contact number. Thank you very much for joining us.
Thank you. It was a wonderful session.